All right, our patient's on the table. Let's poke. Pump the brakes. We're not ready to be poking yet. We got to get our patient ready. So we need to go back to x-ray school. Get rid of the necklaces. Get rid of the earrings. Get rid of the EKG leads. Oh, they're the worst. Anything that is going to be in our way for imaging, we need to use our x-ray vision. What am I going to be doing? All right, we're going to be embolizing the spleen. All right, well, I got like 12 EKG leads here. Let's move those out of the way. Check with your nurse if you don't know where to put them properly. High and wide is usually the best, depending on what you're looking at. We want to make sure bobby pins are out of the way, earrings, necklaces. Not just the radiographic artifacts, but we also wanted to start thinking about our sterile field. All right, so it goes back to shaving our patients, getting the hair out of there, any old tegaderms from previous procedures, underwear, undergarments, people still come in with that stuff on. I got to talk about a pannus. I got to talk about the pannus. Just found out upon researching for this video, it's not really called a pannus. We all call it the wrong thing. It's called like a panniculus or something. I'll put it here what it really is.
Mag up one here. Panniculus, dense layer of fatty tissue consisting of excess subcutaneous fat within the lower abdominal region. Panniculi can form after rapid weight loss. Not a pannus. Panniculi. It's never going to change.
But either way, the fat apron that gives us that muffin top, some people have bigger ones and it gets in the way of where the doctor needs to go for femoral artery access. So we're going to pull that sucker up, tape it, pull it up. Some companies have pannus stickers, so you stick it on there and retract it up. Let's see, what else do I have written down? Tegaderms. Yeah. Keep it clean. Keep our patients safe. All right, so next is going to be our working area. So from the feet down the patient's legs to the end of the table. Let's keep that area clear. It's really easy to forget, especially in emergencies. There's blankets that like to bound up there, tape rolls, sometimes you have wound vacs. Those, sometimes you can't avoid those, but use it to your advantage. Create a little tray, like a backdrop so nothing like flies off the table. Set yourself up for success so you're not tripped up later. And what else? Oh, pulses. Cannot forget the pulses. You got to get that pulse. Anyway, you want to make sure the patient leaves your department as they came in, if not, hopefully better, right? If they did not have good pulses at the beginning of the case and we're there to work on their arteries, hopefully you'll have better pulses at the end. You're going to be checking the dorsalis pedis and the posterior tibials. We'll go over anatomy in another video, but you want to make sure those suckers are still there. If you don't know how to do it, ask a nurse. Maybe I'll make a video on how to do it. Usually our nurses, they learn that in nursing school and they're there to help and usually get that stuff done for us. But it's always good to know because we are part of the team and we're going to make it happen. All right, break.